Chennai, and I am Dr. Balaji. I am a vascular surgeon practicing in Apollo Hospital, Chennai for about 23 years. I've had previously about 10 years of overseas experience. So basically my experience spans for about 33 years or so in this field. I think vascular surgery is probably may not be a well-known specialty for many people. So briefly I will tell what exactly the vascular surgery and the specific topic what we are going to discuss today. Vascular surgeon is the one who deals with all kinds of blood vessels in the body except brain vessels within the brain and brain vessels in the heart. Basically, in the heart, cardiac surgeons deal with it, and within the brain, neurosurgeons deal with it. Everywhere else, vascular surgeon deals with it. For example, neck blood vessel, hand blood vessels, in the abdomen, in the leg, etc. Commonly, a vascular surgeon deals with blood vessels in the leg because so-called the peripheral vascular disease is very common in the leg. But the same process, so-called the blockage or weakening of the blood vessels, can happen anywhere else in the body. What is commonly known to a patient is a heart attack, which is a blockage in the blood vessels in the heart. Patient presents the chest pain, heart attack. Patient goes on to have an angioplasty, which is putting a stent in the heart, or patient goes on to a bypass operation, which happens in the heart. Same thing can be done elsewhere also, anywhere else in the body also. So same blockage can happen in the leg, in the hand, in the neck vessel going to the brain. So same process, that is angioplasty, stenting or bypass, can be done for other blood vessels also, and that is what we do primarily. That is, we do both angioplasty, stenting as well as bypass. So that is unique. For example, in the heart situation, a cardiologist will do an angioplasty, stenting, and a cardiac surgeon will do a bypass operation. But we as vascular surgeons, or we call ourselves as vascular specialists, we do both angioplasty, stenting as well as for bypass operation. Also, the other side of the blood vessel is what is called veins, which is carrying bad blood or returning the blood to the heart. We deal with that also. That is called varicose veins or thrombosis. Again, there are open procedures as well as endovascular procedures for that also. We do what's called a radiofrequency procedures. We've been given a booklet on that, radiofrequency, which is very, very common. As you know, varicose vein is a very common problem. We deal with that also by minimally invasive procedure, or otherwise called intravenous procedures. And patients coming with deep vein thrombosis, that is blockage of the blood vessels, again we can do by what's called endovenous procedures called thrombectomies and stenting for the veins. And today, a unique procedure, what we do, which is very, very special in Apollo Hospital, what is called awake procedure for carotid artery surgery to prevent stroke. As you know, stroke is a very common problem affecting elderly, and the risk factors are commonly smoking, diabetes, age, blood pressure, hypertension, cholesterol problems. Strokes are of two kinds. One which happens due to blockage of the blood vessel, what is called a thrombotic stroke. The other one is called hemorrhagic stroke, which happens because of bleeding. Commonly, the stroke around 80% or 85% is due to what is called occlusion or thrombotic stroke. Here you see a 93-year-old man who presents. He is a retired officer. He is suffering from blood pressure, asthma. Had a minor stroke 1 year ago. That is, he has been given a warning 1 year ago during the COVID pandemic. That is why he did seek medical attention. Now it comes with another attack of loss of consciousness and inability to walk. That is, he is going for another stroke again. He underwent all neurological assessments, including MRI of the brain, which is showing some damage to the brain, what we call infarct in the brain. And the angiogram shows blockage in the blood vessel going to the brain. And this is typically, what we see in this is CT angiogram, that is without any needles or anything. Patient go through a CT scan, and that gives a picture of the blood vessel going to the brain, which is blocked. So it is the heart here, neck here, brain here. So somewhere in the neck, you see this the blockage here. So what we do, see, there are, as you can see, they are all very high risk population. He's elderly, so already had a stroke, he's got asthma, BP, very likely will have a heart problem. So we cannot give a full anesthesia for these patients. So we do these patients surgery under local anesthesia. We give series of injections along the course of the neck to block the nerve supply going to that area. See these? These are the markings. This is the course of the blood supply. And these are the markings. We give injections here. And then comfortably we can open up that small area where the blood vessel is located, and I can see the blockage. Here you can see that I have opened up the blockage and I am trying to remove it. So this procedure is called carotid endarterectomy. That is, there is no bypass involved. We remove the blockage and then we close it up. It's basically like a plumber, when there is a blockage in the pipeline, he closes the valves, cleans it up, and then opens the valve. Similarly, that's what we do. But in this case, I am going to block the blood supply to the brain. That means he can suffer a damage to the brain. That is why I'm doing it under local anesthesia. So that I'll be talking to the patient. As I'm talking to the patient, I can assess what's happening to the blood supply to the brain. So this is called awake cerebral surgery. So we do that and the patient had an excellent recovery. So as I briefly mentioned, the brain attack or a stroke. Heart attack means blood supply to the brain is affected. Brain attack means blood supply to the brain is affected. So that is why stroke is called a brain attack. And if the blood supply to the leg is removed, that's called a leg attack. We are talking about blood supply to the leg is being stopped completely. So this is what I briefly talked about. It can be blockage or bleeding. How common it is? Every 3.1 minutes, someone dies of a stroke, because stroke can be catastrophic and can be fatal also. The incidence increases with age, and it is very common beyond the age of 55. 72% of all strokes happen after 65 years. This is very important because you cannot ignore a symptom. Like my patient, previous year he had a symptom of stroke, he ignored it. 10% of the stroke survivors recover completely. Only 10% recover completely if you ignore. 25% recover with minor disability. 40% with severe impairment and require special care. That means you become disabled, you cannot earn any money for the family. The family has to earn for you to look after you. That is most disastrous thing which can happen. Somebody get a heart attack and dies, okay, patient is lost, okay. But here, patient is alive, he is become disabled, and it's an enormous drain of resources for the family as well as for, if it's the hospital, government is supporting. So, patient is in the hospital for 2 months, 3 months, disabled. So, government resources are drained too. So, that is very dangerous. And 50% of them die. So, it is not only fatal, it's most disabling. So, this is the calculation. You can look at that. The estimated direct and indirect cost of the stroke is $73 billion. And the lifetime cost is each patient $140,000. So I said it can affect all ages, all ethnic group. It is not like it's only Western disease. It can affect our population also. So this is the picture I showed you. This is what called a fat deposit within the artery, which is causing a block. So it can affect any part of the brain. So whichever part of the brain is affected, you get the disability. For example, if it affects the speech area, you cannot speak. That is also a stroke. If it affects the arm is disabled. Leg is disabled. Affect both because both arm and leg is disabled. This is an interesting phenomenon. It's called a transient ischemic attack. This is what we call a warning stroke. This is what you should be very aware of. The patient should know. There is a very short duration of loss of neurological function. It can be your eye, it can be your speech, it can be your sensation, it can be your movements. So it is so short that patients tend to ignore. For example, somebody is in the bathroom having a bath. Suddenly, he can't pick up a soap or he drops his soap. So he thinks something funny, and then by the time he has his bath, he is recovered. So he will not tell his family that he had some problem. But same thing happens when you're talking to somebody or a family. Suddenly you stop talking or suddenly lose a vision. Somebody knows that something is happening to you. So they can pick it up early. So that is why you should create awareness that this can be very, very transient and patients can get a recurrent stroke. So you should seek the doctor attention immediately. So TA is serious and is very, very often is ignored. So that is why I said TA should not be ignored. More than 1/3, 33% of the patients will go on to have another attack of stroke, 5% within a month, 12% within a year, and 25% within 3 years. So if you catch them early, do this procedure, they will never look back again. They are fine. No further strokes. So please take home this message. Recognize these symptoms very early. Do not have any denial, or this will not happen to me and all those things. And there is a procedure which can cure you for the future problem also. And people do worry about the cost. That's what we were discussing earlier, Oh, if you go to Apollo Hospital, it will be very expensive. But imagine what if you don't have a stroke. That is what you're supposed to think. And think about symptoms all the way. And please trust the hospital for these procedures because there are excellent techniques available, excellent doctors available to make it very, very safe. The international standards for the complication of this, any procedure will have complication. One of the major complications itself is stroke. International complication rate is about 5 to 6%. Our center, it's less than 1%. We have done more than 800 patients like this. Our center is less than 1%. This is like an endoscopy. You should be familiar with what's called endoscopy. It goes to the stomach. This is called an angioscopy, which can go through the artery. This is how it looks, all your fatty plaque. See this? How bad it is. When the blood is going through, you will take away all these small bubbles of fat into the brain, causing a stroke. So, my message, final message, please catch them early, intervene early to prevent a stroke, which is a disastrous disease. See, very rightly as you said, whenever there is a symptom, don't ignore it. Let the doctor decide whether it's significant or not significant, especially if you are high risk population. Say there is a 25-year-old man who is at work, fit otherwise, develop the symptoms, first time you can ignore. Even him developing another attack, you have to be careful. Because stroke and we have operated on 28-year-old gentlemen also, because they have what's called dyslipidemias. Even young people can have very, very high cholesterol levels due to what's called a familial dyslipidemia. But heart attack can have very good behaviors. So maybe first time you may miss it. Second time certainly you can't ignore it. So the stroke, what normal people think is complete disability. That is not the stroke. What you are looking is, before patient develop, if he gets a warning stroke, that is, we discuss about 15% of patients giving a warning sign. It can be a speech defect, it can be a visual defect, it can be sensory defect or a motor defect. Wherever the clot goes to, the brain is like a geography map. You have in a geography map, you have Africa, you have Asia, you have America, you have Japan, you have Australia. Whichever part is affected, that part gets defective. So if it goes to speech area, momentarily you may lose a speech. That, as I said, we are having a discussion, suddenly stops, and then maybe after 20 seconds or so it comes back again. That is a serious issue. Especially, only a close family can pick it up. Because outsiders cannot pick it up. So, something wrong. Somebody is kind of drooling, suddenly, angle of the mouth going down, some saliva is drooling, something wrong, go to a doctor immediately. Similarly, eye. You are reading a newspaper, suddenly one eye is okay, one screen comes in between. You go blank. It's not complete blank. So, you are reading a newspaper for a second, goes, and then comes back again. If you tend to ignore that stage, this is called amaurosis fugax. You tend to ignore again, next time you'll be completely blind. So, you have to be careful. Fortunately, I'll tell you, this can be picked up very easily, even in Port Black, or I should find out whether it's available in other islands also. This obviously you have to go to a doctor. You need not go to a neurologist. First you go to a doctor. Ultrasound is available everywhere. All that you need is an ultrasound and a CT scan. CT scan of the brain to rule out that you do not have a stroke. Then there is an ultrasound of the neck blood vessel. You can clearly see. This is what called a B-mode ultrasound. See that? And this blood vessel, the brain blood vessel, is easily accessible for ultrasound. If you have a good ultrasoundologist, a good radiologist, they can easily pick it up. See, this is an ultrasound which picks up and then CT scan which confirms. And then you come to me for. Not everybody is going to have. In my study, whatever we see, only about 8% of the patients will require surgery, not all 100%. So you do a basic screening, but do not ignore. But if you imagine, even if you save 8 out of 100 strokes, that is a big number because stroke is such a common problem.
Thank you.
Thank you.